It's no secret that masturbation can be an enjoyable way to pass the time, but masturbation is still so often treated as a taboo subject, and it's easy to feel confused about whether you should masturbate or how much is too much. The most prevalent questions that I get as a sex therapist and psychologist are usually around masturbation. People want to know, is masturbation healthy? How much masturbation is too much? Is it okay to masturbate if I'm in a relationship? Should I masturbate at all? And like many questions about sexual behavior and mental health, the answer to whether masturbation is healthy is a deeply personal one. What's healthy for one person may not serve another. And yet, studies have shown time after time that there are clear health benefits to enjoying a little alone time with the body. So why then do so many people struggle to talk about masturbation without going red in the face? Well, often it's because so much of our feelings about masturbation are tied to cultural, historical, and religious influences, whether we realize it or not. The history of masturbation is rife with words like sin, disease, and even self-abuse. It's no wonder sometimes people struggle to enjoy self-pleasure without feeling guilty. In the 18th century, masturbation was even considered a disease that could lead to insanity and other serious health conditions. And by the early 1800s, this belief was pushed into the spotlight by health reformer Sylvester Graham. You may know him best thanks to his invention of the certain cracker. Anyway, Graham was a Presbyterian minister who preached that all pleasurable sensation was satanic temptation in disguise, and that any behavior that was immoral had to be unhealthy too. So naturally, according to Graham's teachings, masturbation was out. But even today, when sexual health researchers have retreated away from condemnation, away to support of masturbation, it's still a taboo subject for many people. Extensive research about masturbation is also lacking, so the debate about its pros and cons rage on. But let's get to the point. Is masturbation healthy, or can it negatively impact someone's physical and mental health? Well, despite the way many people feel about it, studies have shown that it can have real benefits for both physical and mental well-being. So let's talk for a second about how masturbation can be healthy. First of all, it can have awesome effects on your mood. Studies have shown that having an orgasm causes the body to release dopamine, endorphins, and oxytocin, which is the love and bonding hormone. So producing more of these feel-good hormones through masturbation can help lower your cortisol, which is a primary stress hormone that can lead to inflammation, insomnia, and weight loss resistance. Higher levels of oxytocin can also make us feel happier, reduce cravings, and improve your overall mood. Sounds like it worked to me. Masturbation can boost self-confidence and body image. So female masturbation in particular can also have positive impacts on self-confidence and body image. Studies have shown that masturbation can lead to a sense of autonomy and bodily integrity that can improve an individual's sense of identity. On the other hand, feeling guilty about masturbation can inhibit a woman's comfort within her own body and can even lead to negative attitudes about contraceptives. Yeah. Okay, number 3, masturbation can improve your sexual satisfaction. Well, that might seem contradictory to what you're thinking because masturbation is something that's often done alone, but masturbation can be a powerful way to learn more about your body and your preferences. And by helping people understand how their bodies react to different activities, masturbation can actually make other experiences more pleasurable. Masturbation is also becoming a more commonly prescribed sex therapy intervention and has even been used to treat various sexual dysfunctions, including premature ejaculation in men. Masturbation can actually lead to a longer life expectancy. So a 25-year study found that greater frequency of sex predicted a lower annual death rate for men, while enjoyment of intercourse predicted a lower mortality rate for women. The benefits associated with more sexual activity have the biggest impact on coronary heart disease mortality. So in other words, sex can be good for your heart. And while this study primarily focused on actual sexual intercourse, male masturbation and female masturbation can have some of the same benefits, helping to reduce cortisol and stress, reducing inflammation, and boosting mood hormones. A Harvard Medical School study actually found that increased ejaculations, including from sexual intercourse and masturbation, were linked to a decreased risk of prostate cancer for men. So compared to men who reported 4 to 7 ejaculations per month across their lifetime, men who ejaculated 21 or more times each month saw a 31% lower risk of prostate cancer. Just one more reason to make masturbation part of your sex life. Okay, so while masturbation has been shown to have tons of physical and mental health benefits, it is possible for masturbation to have some negative health consequences too. Masturbation is a really personal thing, literally and figuratively, and the only person who can evaluate whether you masturbate too much is you. There's no black and white answer about what is right or wrong when it comes to masturbation. In reality, excessive masturbation is only excessive and only a problem if you deem it to be a problem for yourself. But wondering if masturbation is something that you should take a closer look at, here's a few signs to think about that could tell you masturbation could be compulsive or could be having some negative impacts on your health or self-esteem. Okay, one of the most telling indicators that masturbation may be compulsive is if you've tried to stop, slow down, or curtail your process for a little while and you found yourself unable to do so. And too much masturbation may make it difficult to navigate other areas of your life successfully. You may start forgetting to complete tasks, make less time to be social with your friends, family, or your partner, or start neglecting other areas of your life because most of your waking, maybe even sleeping time is spent organizing yourself around masturbation. Masturbation can be a problem if it's no longer as pleasurable as it once was. So when masturbation becomes compulsive or excessive, what once felt satisfying now barely lets you whistle. This can happen in terms of frequency of masturbation or intensity. So what once turned you on easily may now not register any arousal, prompting you to seek out more intense or more taboo fantasies or visual props or erotica. Remember how masturbation helps increase those wonderful mood-boosting hormones? Well, compulsive masturbation or unhealthy masturbation can actually make it hard to replicate those feelings without self-pleasure. So if you're irritable, anxious, depressed, or notice difficulty sleeping if you do not masturbate, this could be an indicator that you're experiencing some withdrawal symptoms or have been using excessive masturbation to cope with underlying stresses at the expense of other coping strategies. So masturbation can have a negative influence on your life if it's affecting your sex life with humans. So if you're struggling with compulsive masturbation or excessive, you may notice a decrease of arousal or an increase of sexual anxiety with real-life partners. You may even find that you can't orgasm with other people. Too much masturbation can impact your partner too, leaving them feeling alienated, sometimes cheated on or betrayed. So if your relationship to masturbation is causing friction in your relationship with a partner, you may decide that the disruption is a negative consequence, and you might want to peel back a little bit on your masturbatory practices and see if that helps. So a couple of other things to think about when you're evaluating if masturbation is healthy for you. There can be some negative legal, financial, and personal consequences that result from excessive masturbation. In some cases, you might find yourself blurring boundaries in your life when masturbating becomes all-consuming, even if it goes against your own value system. For example, masturbating at work or accessing pornography on work-related or work-issued computers or tablets can violate company policies and lead to temptation. You may find yourself spending money on payment-focused porn and fantasy play or extortion and find your savings rapidly depleted. You may even find yourself neglecting the role as a parent. And this can occur because too much masturbation is taking up so much of your bandwidth that you're no longer able to make time to engage with your children. So if after watching this you feel like compulsive masturbation could be a problem for you, take a deep breath because you're not alone. You're not a bad person, and it's help. Some people like to test themselves and go without masturbation for 30, 60, 90 days to see if they still feel autonomous in their sexual choices. And if you choose to do so, maybe organize your thoughts and feelings during this time, and perhaps write down when you have the urge to masturbate so you can start recognizing patterns. Create a list of alternate hobbies, and practice other activities to reduce the likelihood of using too much masturbation as an excessive coping strategy, and learn new methods of getting your needs met. And lastly, get support through sex therapy or other means. Sitting with the fear or shame around sexuality can be wildly isolating, which is a risk factor for excessive masturbation or tipping the scale from healthy to unhealthy masturbation. So getting support can also mean reaching out to a trusted friend, a family member, a partner, a member of your religious community, or even a support group such as Sex Addicts Anonymous, which offers anonymous online and in-person meetings. So remember, when it comes to answering the question, is masturbation healthy? Only you can know the answer for yourself. It's important not to feel shame or guilt around self-pleasure and to review your masturbation habits with open eyes and an open mind. Okay, this video was helpful. Don't forget to like and subscribe. There is so much more content coming that covers the intersection of mental health, relationships, and sexuality.